Tell me a little bit about the principles on which you did that.
First was recognising that general practice would be looking after the majority of people with COVID-19. Based on what we'd seen with the rollout of the pandemic, particularly in China, we knew that some people would get very sick and would require hospitalisation and intensive care and ventilators, but the majority of people would have a somewhat milder illness and would be able to be cared for in their homes, and also monitored, though, to make sure that they weren't deteriorating to the point where they did need hospitalisation. At the same time, general practice would be involved in testing many people, and so having to have the capacity to do testing as well as then management and care of people with COVID-19. And so therefore the need to set up, to change the model of care in general practice so that people were being tested away from the regular general practice settings. And so we've set up in Australia many general practice-led respiratory clinics, which often operate next door to the regular general practice, but are a place where people can go with symptoms to be assessed and, if appropriately, be tested, whereas the other part of the clinic is for the rest of the care. The second principle was around caring for people who are vulnerable to COVID-19, and again recognising that general practice is absolutely fundamental in looking after the vulnerable people in our communities. And what we knew from the experience in China was the people who were most vulnerable were the elderly and people with comorbid conditions, with certain chronic conditions, people who are immunosuppressed. And these people, of course, are a core part of the people that we care for in general practice. The third was about this, making sure that we continue to have regular primary care services available to the population throughout the pandemic. We know from past experience that very often more people will die from acute conditions, from the failure to manage chronic conditions, from the failure to manage mental health concerns, from the failure to continue our preventive interventions, especially for cancer. More people will die from those conditions, which can be preventable, than die from the actual infectious agent. So absolutely essential that general practice was able to continue functioning. But we had to again change the model of care. And as I know has happened in the UK, we immediately rolled out telehealth, either by telephone or by video consultation, to the entire population, so that your general practitioner could reach out to you, or you could reach out to your general practitioner to get continuing care. And especially as the country's been in lockdown, telehealth has come into its own. We've had over 10 million consultations with telehealth between GPs and their patients over this time. And the fourth area was around protection and protecting the healthcare workforce, and recognising that the people working in general practice and in primary care need to be protected and need to have adequate access to personal protective equipment, as people do who are working in hospitals, in emergency departments and in intensive care units and elsewhere. And like the UK at the start of the pandemic, we had very substantial shortages of personal protective equipment. In Australia, there was a lot of it we had a national stockpile, and that went out to hospitals and to intensive care units. But a component of that was retained for general practice, to make sure that GPs could be protected in the work they were doing, and also went out to aged care, so aged care workers could not transmit to their patients, the most vulnerable people, and out to home care for people providing care to the elderly and to people with disability in their own homes. So again, trying to protect the people most at risk. Since that time, we've actually added a fifth element to our key principles, which is around the mental health of the population and also the mental health of our healthcare workforce. I don't think anyone predicted the level of anxiety and stress and fear which would affect the entire population, but which has particularly affected the healthcare workforce, with people just not knowing whether the next person who's coming into your consulting room is going to be someone who's infected with COVID-19, and whether you are going to be infected and then your family infected. So the impact on the mental health of the country, and indeed I think everyone in the world, has just been extraordinary. So that's now a core element of what we're doing. And the government in Australia took these principles, developed the National Primary Care Response Plan, and then allocated 1.5 billion Australian dollars to allow us to roll out that plan, to implement the telehealth with the free consultations to the public, to set up. We've now got nearly 500 respiratory clinics, many run by GPs, many run by hospitals across the country, some run by the Defence Force, to make sure that we had the PPE. Over 7 million masks have gone out to general practices right across the country, as well as gloves and gowns and goggles and masks and so forth. So a huge investment in making sure that primary care was well prepared and well supported, so that it could continue to provide the services needed by the population.
Today I've been talking to Professor Michael Kidd, a GP colleague and Deputy CMO for Australia. Michael, thank you very much indeed.
Thanks, Donald. Thanks to you all.